What's better, saline implants or silicone implants? There isn't a good answer because both implants have their advantages and both implants have their disadvantages. So let's talk about the differences a little bit. This is a saline implant, and one of the advantages of saline implants is they're a little bit less expensive than silicone implants. Another advantage to saline is the incision is smaller when we insert the implant. A saline implant actually comes like this, it's just got air in it. And so we take a filled tube, insert it, take the air out, and we can fold this implant up kind of like a burrito, so it's pretty small. Slide it in, unfold it, and then fill it up after it's in. So it's easier to put this implant in through a smaller incision. A silicone implant is pre-filled. All the silicone is in there. I can't adjust the volume, so I've got to stuff this in through the incision. So typically my incision's got to be maybe 20 or 30% longer with the silicone implant than it is with the saline implant. Another potential advantage of saline implants is if the implant ruptures, the saline, which is sterile solution, leaks out, your body absorbs it and gets rid of it. So the breast loses the volume. So it's very obvious that a saline implant is ruptured because you get pretty much like a flat tire. Okay, one breast is suddenly much smaller than the other. No special tests are required to determine whether you have a rupture with a saline implant. With a silicone implant, the scar tissue that forms around the implant holds the silicone in place. So the vast majority of silicone, when an implant ruptures, stays within that pocket. So the breast doesn't change size really very much when you get a ruptured silicone implant, which is one of the reasons why the FDA recommends if you get silicone implants, you should get an MRI within about 3 years looking for rupture, and every couple of years after that. Now, obviously, there's nobody out there forcing you to get an MRI, but that's still a recommendation to try and determine whether or not there is a rupture of a silicone implant. And I think the final advantage of saline implants is there's a lower risk of what's called capsular contracture. When you put an implant in, you're going to form scar tissue around it. And that scar tissue, if it stays thin and stays pliable, then the implant stays soft and pliable and feels more like a natural breast. Saline implants underneath the muscle, which we pretty much always do, have a very low risk of capsular contracture. In my experience, probably less than 1 or 2%. With silicone implants, there's a little bit higher risk, maybe 4 to 5%, and that can squeeze the implant, again, make it hard and painful, and can actually make it a funny shape. So saline, lower cost, smaller incision, easy to tell if they rupture, and lower risk of capsular contracture. What's the downside to saline implants? Well, saline implants, if you don't have much to cover them up, feel like a water bottle because it's a water bottle. Saline implants also can ripple. You can see the edge can ripple a little bit and around the surface of the implant. Now, typically you're not going to see that around here if it's underneath the muscle, but underneath and out to the side, if you're fairly thin and don't have a lot of breast tissue to cover it up, then you may see that rippling. So now, silicone implants, the big advantage is they tend to feel more like a natural breast because silicone feels more natural than saline does. And silicone implants, although they can ripple as well, tend to have less severe problem with rippling than we see with saline implants. The downside to silicone is, again, longer incision, cost is more, risk of capsular contracture a little bit higher, and again, it's harder to tell if they rupture because the size doesn't change very much. So what do I recommend for a patient that comes in here and really doesn't know what they want? For a patient that has a fair amount of breast tissue to start with, and they're not really thin, they have a reasonable amount of tissue to cover up the implant, and as long as they're not going too big, I tend to recommend saline because they don't need a more natural feeling implant since they have plenty of tissue to cover up the implant. That's one end of the spectrum. Now you take the patient at the other end of the spectrum who comes in, they're very thin, have very little breast tissue, and whatever I put in there, that's what it's going to look like. That's what it's going to feel like. For that patient, I think silicone is the advantage. So those are the extremes. Everybody else falls in the middle. And you decide based on the advantages and disadvantages of each and what you're starting with and where you want to go, whether saline or silicone is best for you.